Gabe was just a week shy of 1 when he was diagnosed. At the time, I was feeling very lost, like I really didn't have a place. The doctors all knew what they were doing, and the nurses knew what they were doing, and I really didn't know what I was doing at all. I didn't know what my job was anymore. Chemo Duck came about really as a result of a friend leaving me a stuffed animal for Gabe, and the whole project developed very naturally as a way to reach out to other families. We're really about joining families together and educating families, educating the whole family. When I see a child hugging a Chemo Duck, it's just the most heartwarming thing in the world. It's incredible.
That's very nice.
Yeah!
What's been really important in using Chemo Duck as medical play, not just simply as a toy to help children relate, I think has been our child life services. We have child life specialists, and they latched right on to Chemo Duck as a medical play tool. So they're trained, they know how to use the duck to teach.
You get it? Yeah, it's being kind of tricky. Here.
I don't know how they get that. And that's just like they would do Chemo Duck.
We've also had our psychologists involved to show us that, yes, you can see the decreased anxiety with the children. We haven't done scores and scales to reveal such things, but the child life specialists and the psychologists who work with the children and know them so well can obviously see the difference in the children who used Chemo Duck and children who didn't get exposed to Chemo Duck and how much more relaxed they are.
Should I listen anywhere else?
Yeah.
From a doctor's perspective, it's funny to see the different doctors go into a room and see Chemo Duck, and we all sort of gravitate towards him.
Ducks' hearts beat faster than children's. Did you know that?
Mm-mm.
Melissa?
But I do know. Interesting.
Many doctors, not just myself, start using Chemo Duck very naturally with the children to explain things. It helps curb their fears, and it helps them understand better what they're about to go through.
We can give him a little drink of water, can't we?
One way we found Chemo Duck very helpful is using the duck before you do anything to the child, which we find helps reduce the child's anxiety quite a bit, and then also gives that child a sense of control. For example, when our children first come to clinic, they usually get what we call accessed, meaning they have something called a portacath in their chest underneath the skin that a needle has to go in. And while it's easier than a standard IV line and it's easier overall for the child, it's still a poke with a needle. So our nurses started naturally taking Chemo Duck and saying, well, let's access Chemo Duck.
Look, we could draw some blood from Chemo Duck, or we could flush him. He's already got a nice dressing on there. Who's going to be first and get their port put in?
Spot.
Scott? You're volunteered?
It's Velcro.
It's Velcro, I know. It's sort of pretend, isn't it?
And initially, the nurse might access Chemo Duck, but then the children always say, I want to do it, I want to do it.
You squirting the heparin in?
Then the child was able to sort of become the nurse or become the doctor and do the procedure to the duck before it was done to the child. And as I said, gave the child a nice sense of control over the situation.
Do girls know why it's important? Can you tell me, Ellie, why is it important?
Because you could get sick and it could get bacteria in your line.
You're right, you can get bacteria in your line, and that's a really thing that we don't want to happen, right? No.
There's very important cleaning of the line, and you have to learn to do this as though you are the nurse or you are the doctor. And so we often can use Chemo Duck to teach the children so that they're more comfortable, and to teach the parents so that they're more comfortable as well in doing this line care. And then that empowers the family to be able to take good care of this child, which can prevent infections and actually keep the child out of the hospital.
I think yours might even fit in there too.
Our children often have to go through many tests or procedures. While these tests don't usually hurt, they can be very scary to a child. So one thing we found with Chemo Duck is it's really fun to use the duck to explain a procedure.
He'll have to take the glasses off when he goes in the MRI machine, won't he? So can you take his glasses off for him? He's not allowed those in the thing.
This actually started when Gabe had to go through a CT scan and then an MRI test, and his mother just made out of a shoebox initially a scanner, an MRI scanner. And then we could take the duck and this shoebox MRI scanner and explain to Gabe what was going to happen. And he could see that nothing was actually going to happen to the duck. It wasn't going to hurt the duck. It was just scary. So then when he went for his own MRI test, he was much less anxious about it, which also allows them to use much less anesthesia, less medication, which makes the experience better for everyone.
So wake up, Chemo Duck.
Sometimes the simplest procedures are actually the scariest for children.
We're gonna put this on here, like this. You have to keep your arm really still.
And I'll use the example of getting your blood pressure taken. When we go to the doctor, we don't think anything of it. We know there's a little pressure and it's going to quickly be over and it doesn't hurt. But to a child, that's a very, very scary thing. Many children, it's difficult to get a good blood pressure because they cry so much during it, which makes it an inaccurate reading. But we can use that blood pressure cuff and take the blood pressure of Chemo Duck, and the child can initially watch and see that it doesn't hurt. And then the child can actually take Chemo Duck's blood pressure as well.
Tell him, say it's not gonna hurt you.
And that medical play then sets the child up to be ready to have his or her own blood pressure taken without the anxiety and also then with an accurate reading.
On a big hug.
Chemo Duck serves many roles. He's educational, but also he's a great source of comfort to the children. For one thing, he is actually a soft, plush, comfortable duck for them to hug, to go to sleep with. But also, children play creatively, so then the child can play with Chemo Duck. The child becomes the doctor, becomes the nurse, and plays with the duck in the child's own creative way without adults telling them what to do. And this gives a child a sense of control and a companion. Our children often can't play with other children because their immune systems are suppressed by chemotherapy. And the duck becomes this buddy.
You want to listen to him?
¿Quieres escucharlo?
I think this helps create trust between the child and the doctors and the nurses, because the child then puts himself or herself into the position of being a medical caretaker and sees, you know, I could be the doctor or the nurse, and Chemo Duck is my patient, and we have this relationship that's okay. And so then the child can naturally go to the doctors and the nurses and have this trust, because the child's built this relationship already in the same manner with the duck.
You take the syringe and then you can't put the medicine in the tube without unlocking the lock. And then you do that and then you twist it on and then you push it in.
When their child is first diagnosed with cancer, the family then has to go home and they have to explain to other family members, to friends of the family, what's going on with that child. And one thing we've heard from families is that they use Chemo Duck to do so. The children then tend to do the same thing. Children are playing with other children. They're playing with their siblings, or if they're able to have friends over to play, they have Chemo Duck right there with them. And children just are naturally curious, so other children start asking them questions about what's been going on with them. And they have the duck right there to help them explain.
Parents really can take the Chemo Duck and make it part of the family and really use it to help their child in the best way that they can. I've always wanted to have an opportunity to reach out to parents and to let them know that when you feel like you're so alone and there's nobody in the world can understand you, that there are people out there that understand exactly what you're going through. I think you need to reach out and find stories of children who have made it through and they're on the other side of this battle. There's always, always hope.